Hello, my name is Tim Lynch. I'm a consultant neurologist at the Dublin Neurological Institute at the Mater Hospital. I'm Chief Academic Officer for R&D's Hospital Group, and I'm Vice Principal Health Affairs in University College Dublin. I'd like to remind you about Brain Awareness Week that's coming up, and in particular about mind and brain health. Your brain up there, of course, is 100 billion neurons that are connected intimately together through synapses or connections. There are trillions of connections, like a big tree where these neurons connect to each other, actively involved, of course, in memory, language, mathematics, movement, sensation, vision, hearing, etc. Neurological disorders often prune or affect the branches and twigs of these synapses and prune them away over a number of years, in particular Alzheimer's disease. These unfortunately are common disorders. 1 in 3 women get Parkinson's disease, Alzheimer's disease or stroke in their lifetime, 1 in 4 men. So, how do you manage to avoid these disorders, and how can you keep your brain healthy and well throughout your lifetime from cradle to grave? There's some clear evidence that exercise is very important in this circumstance. People talk about, in sport, muscle memory. That's rubbish. It's brain memory. In particular with movement control, when our brain decides to go somewhere, it commands the automatic center for movement in the brain called the basal ganglia, or short for BG, and it hones away and does that movement. And as we train and practice, it gets better and better because it makes more connections and adjusts those so that your memory in your brain reserves and keeps that information how to play that sport well. So exercise is important for brain health now, but also in the future as we get older. Secondly, intellectual activity is really important for a similar reason. When you give novel challenges to the brain, it results in the brain generating new connections again and new synapses, so it gives more reserve in the brain. So if disorders in later life come by, that there's a bit of a backup so they can be delayed in onset. So keeping the brain active and busy and giving it novelty on a regular basis is a good idea. Thirdly, diet's important. And in particular, Mediterranean diet's important, and probably supplementation of vitamin D over the winter months in the miserable weather we get in Ireland during that period of time is always a good idea. And then finally, sleep is also important because remarkably when we sleep at night time, our brain swells and vessels inside the brain called lymphatics open up and allow washing of the brain tissues by the CSF that bathes our brain and spinal cord through the brain, cleaning it at night time. In other words, it's garbage disposal time when we sleep at night, refreshing the brain and getting rid of many proteins and other things that accumulate during the brain during the day that can interfere with normal brain function. I always like to add a last one, and a keen sense of humour I think is always important, because a good belly laugh results in a particular big dopamine surge in our brain, and dopamine is the most important neurotransmitter for movement but also for reward, and often we feel better with the same. So, Brain Awareness Week, don't forget about it, and brain health is really important, and we need to pay more heed and attention, particularly in this country, to our mind and brain and critical thinking.